Hi, my name is Merritt Temple, and today I'll be talking to you about osteoporosis. Osteoporosis translates to mean the condition of porous bone. Our bones are in a constant state of renewal in which old bone breaks down and new bone replaces it. When we're young, our bodies make new bone faster than it breaks down old bone, and as we age, bone mass is lost faster than it's created. Osteoporosis occurs when the body loses too much bone, makes too little bone, or both. As a result, our bones become weak and the risk of breaking a bone increases. Our bones can become so weak and brittle that even mild stresses like bending over, coughing, or sneezing can cause a fracture or a break. Due to its prevalence worldwide, osteoporosis is considered a serious public health concern. It's currently estimated that over 200 million people nationwide suffer from this disease. Aging of populations worldwide will be responsible for a major increase in incidence of osteoporosis in the next 30 years. Currently, the worldwide annual incidence for hip fractures is about 1.7 million people, and that number is expected to increase by 240% in men and 310% in women by the year 2050. Here's just another example of the projected number of bone fractures due to osteoporosis worldwide. There are several risk factors for osteoporosis, both controllable and uncontrollable. Uncontrollable risk factors include people over the age of 50, specifically women who are thin and have a small frame and have recently gone through menopause. Osteoporosis is more common among whites and Asians and is more prominent in families that have a history of the disease. Some conditions such as type 1 diabetes, rheumatoid arthritis, and hormonal disorders are also linked to bone loss. The things we can control when it comes to protecting ourselves is to make sure we're getting enough calcium and vitamin D, plenty of fruits and vegetables, and avoid having too much protein, sodium, or caffeine. Having a sedentary lifestyle also contributes to loss of bone density, so monitoring our weight and exercising several times a week can also help to decrease our risk of developing osteoporosis. It can also be caused by taking certain medications, such as seizure medicine or corticosteroids, so monitoring the intake of these types of drugs can help reduce your risk as well. Cutting harmful things out like smoking cigarettes and drinking alcohol in excess can also help to drastically reduce your risk for osteoporosis. In order to properly diagnose osteoporosis and assess your risk of fracture, your doctor will likely order a bone density scan in which your bone density is compared to that of a healthy 30-year-old's, which is when your bone mass is at its peak. The results come as a T-score, and as your bone density decreases, your T-score gets lower, as you can see here. Treatment recommendations are often based on an estimate of your risk of breaking a bone in the next 10 years. The goal of treatment is the prevention of bone fractures by reducing bone loss, or preferably by increasing bone density and strength. Although early detection and timely treatment can substantially decrease the risk of future fractures, none of the available treatments for osteoporosis are complete cures. It is difficult to completely rebuild bone that has been weakened by osteoporosis, therefore prevention is just as important as treatment. Lifestyle changes, including quitting smoking, curtailing excessive alcohol intake, exercising regularly, and consuming a balanced diet with adequate calcium and vitamin D are all important ways in which we can reduce our risk for bone loss. There are currently many global policy initiatives working to spread the message that much more must be done by governments and health insurers to promote prevention, early detection, and accessibility to treatment for those in need. The International Osteoporosis Foundation is a registered nonprofit, non-governmental foundation based in Switzerland that functions as a global alliance of research organizations, healthcare professionals, and international companies working to promote bone, muscle, and joint health. The IOF joined the NCD, which is the Non-Communicable Disease Alliance, in 2015 as the first non-governmental organization representing musculoskeletal diseases. The Women's Health Initiative is a 15-year research program to address the most common causes of death and disability in postmenopausal women: cardiovascular disease, cancer, and osteoporosis. These are just a few of the organizations that are working to promote healthy bones by providing education about prevention and treatment of osteoporosis for all ages and stages by providing evidence-based information from experts in the bone field. And that's all I have. Thank you so much.